Johnny, we were talking earlier on about the very low pay that nurses and healthcare workers in the UK earn. How do you think in the current crisis with the coronavirus pandemic the government are actually going to deal with this?
Well, as you say, nurses and healthcare assistants that we're very much relying on at the moment, and increasingly going to by the sound of most accounts, they actually are on pretty low pay. And shockingly, in the UK, a third of the population have less than £1,500 worth of savings. So whilst the government's recent announcement to pay up to £2,500 a month to people that aren't able to work, clearly a lot more needs to be done. But isn't it sort of sad almost that we've got companies like Facebook that are now paying their employees $1,000. They've got 45,000 employees. That's going to cost them 45 million, but that'll hardly make a dent in their 54 billion of cash. Although Facebook is one of only 15 companies in the S&P 500, that's 500 of the biggest companies that are quoted in America, that are net cash positive. We've got other companies in America like Bank of America and JPMorgan. They're actually paying their staff bonuses because they're at the front line and dealing with people who may well be ill. So it's a big shame that the government isn't actually looking to pay nurses and healthcare workers a little bit more money, because without them, the health system can't actually survive. And if we actually paid healthcare assistants, they're on about £16,500. If we paid them more, then possibly we could actually release more people to hospitals and get people into the community, and therefore create more space for those that are going to critically need the actual space and need attention in the hospital space. Unfortunately, the average pay for a nurse in the UK is £24,800, which compared to America, they earn £63,000, and the average nurse in California gets £85,000. But one of the other challenges facing healthcare workers is that those caring for vulnerable people need to have disclosure of borrowing checks, formerly DCRB checks, carried out, and they also need to maintain their continuous professional development. So the way that blockchain could possibly help here with governments is that if we followed the example in the UAE, we could have all this information held onto a central database so that those that need it, governments, employees, and potentially patients, and then they could check to see the recommendations, the qualifications of the people that they're actually looking after and caring for them.